one to ask for a lot of things. But when you're crying tears because you're laying in your own poop or urine, I just couldn't believe it.
I'm on the phone with Frank and Lucy. Out of concern, out of retaliation, they agreed to share their story in a phone conversation rather than on camera. They've been inseparable since getting married over 40 years ago.
We need each other.
In January, Lucy suffered from a stroke. Little did she know this would be just the first of many serious health issues.
I'm 82, my wife is 73, and, at that age, we were trying to enjoy a little of our senior years, which just turned into an absolute nightmare.
In the last 4 months following her stroke, Lucy has had to have her leg amputated due to a bacterial infection, as well as developing C. diff, a colon infection, because she says she was left sitting in her own feces.
Never in a 1,000 years would I believe that these people could be so cold and callous.
They said it all could have been prevented if the nursing homes Lucy was in weren't neglectful, an abuse Frank couldn't see firsthand as he was banned from visiting her. All of this occurred as the coronavirus pandemic set in.
The care was horrendous.
Because the pandemic has caused nursing homes to go on lockdown for months, elderly advocate Carol Herman is concerned elderly abuse is going under the radar.
I always think that the family members that go in to take care of their family members, they're the eyes and the ears of the patient, and they're going to see what's going on first-handed. Now that they're being denied access, it's very scary.
It's a worry shared with California State Long-Term Care Ombudsman Joseph Rodriguez. I'm wondering if, with that huge decline, are you worried that those, kind of watchdogs or those eyes and ears aren't able to see, the abuse that might still be happening during this time?
If the licensing agency isn't in there, if families aren't in there, if we're not in there, then who's providing that oversight? Who's looking out for residents? I'm very concerned about not being able to get in and very concerned about what we're going to find when we do go in.
As the California Ombudsman, Rodriguez serves as an independent representative established by both the federal and state government to advocate for nursing home residents. Reports of abuse typically go to his office.
We're really more of a watchdog group. We work in the direction of the resident or the resident's representative. We advocate on their behalf.
Those reports have gone down substantially since the start of the pandemic. Rodriguez says in February he received 603 reports of abuse, neglect, and exploitation. In April, it was 340. That's a 44% decline. He said he believes this is due to the Ombudsman office, as well as families not being able to go into facilities.
The federal government has barred us from going into facilities at this point in time. So, we hear a lot of problems when we go into facilities.
He also says social distancing may be causing a decrease in abuse between residents. Nursing homes have a different story. Multiple nursing homes in our area we reached out to declined an interview, but shared the sentiment that a lower census of patients and residents recovering from procedures in nursing homes has caused the number of abuse cases to go down.
We also know that facilities are extremely taxed right now in order to provide care to residents. They're just not calling us with reports of abuse or neglect.
But overworked staff is part of why both Rodriguez and Herman believe infection control and neglect in nursing homes is an issue.
If you have adequate staffing, you're going to have better care and better outcomes for residents.
If they're not going to take care of the patients, and if they're not going to staff accordingly, then get out of the business.
That's why California protocol requires nursing staff to ensure each resident gets 3.5 hours of care. But with certain waivers, some nursing homes are able to only provide 3.2 hours of care. But concern has always been there around staff being stressed and not able to provide proper care. And the pandemic has shone a light on that.
That's been a problem for years that we've tried to highlight and point out. And the pandemic has really exposed that. It's not just infection control, it's infection prevention.
In fact, the Government Accountability Office released a report that said 82% of nursing homes had deficiencies around infection prevention and control.
We've known for years that infection prevention and control have been a real problem in facilities. Workers, have multiple residents that they're taking care of, and their time is limited. They can only provide so much care if you've got, 6 or 8 people that you're providing care for in a given shift. So we know, people may have cut corners, not washed hands, not used hand sanitizer, not changed gloves.
Lucy and Frank say consistent and compassionate care would have kept them from the life-changing experience they've had over the past few months.
If these places are short-handed, and these nurses have the attitudes they have because they're being overworked, then that is not fair to the patient.
That's why Frank said he took Lucy out of the care facilities and is now her full-time caregiver, while Lucy continues to recover at home.
I'm doing it all: housework, laundry, cooking, feeding, and of course attending to Lucy, which is, almost a full-time job at times, because, she does, no reflection on her, please. It's nature. I'll never expose her to that again.